I had this patient come in the other day to see me. The patient had been struggling with heel pain for multiple years. The patient talked about all the classic symptoms associated with heel pain. Pain getting up from rest, pain first thing in the morning, trouble going barefoot or on hard surfaces. And the patient was frustrated, and rightfully so. They had tried to self-treat at home with all the information that you can find on Google. Stretching morning and night, ice, utilizing the frozen water bottle trick, inserts in her shoes, different types of shoes. Additionally, the patient had seen multiple other doctors and received injections and had had surgery on both feet and was still having pain. Hi, I'm Dr. David Waters from Platte River Foot and Ankle Surgeons, and the reality is that this is not that uncommon. In my many years of practice, I have treated hundreds, if not thousands of patients with heel pain. So let's take a closer look at plantar fasciitis, or heel pain as it's more commonly known. Plantar fasciitis is associated with overuse of the plantar fascia, which is a long, strong ligament on the bottom of the foot, and it goes from your heel bone all the way out to your toes. The thing is, this pain is not usually associated with an injury, but it is usually due to repetitive stress over time. It's very common. 1 in 10 people will experience plantar fasciitis or heel pain in their lifetime, and multiple professional athletes have been sidelined with this condition. Athletes like Peyton Manning, Jason Kidd, Albert Pujols, Antonio Gates, and many more. The question is, what causes this overuse injury? It's all about mechanics. Although there are some other theories we'll discuss. When we walk, you exert 2.5 times your body weight in force across the foot when just one foot is working. On the bottom of the foot, there's a thick, strong ligament structure that is called the plantar fascia. This runs, like we said, from your heel all the way to your toes. And when your mechanics are off, or you're that weekend warrior who wants to go out and go really hard on the weekends, you overdo it and end up with overuse or damage to the plantar fascia. This typically occurs back on the bottom of the heel. Some risk factors that you might have include a tight calf muscle. In fact, studies have shown that up to 80% of cases are associated with tight calf muscles. This decreases the range of motion that you have at your ankle joint and puts more strain along the plantar fascia. Prolonged standing is another risk factor. And it's not just walking we're talking about, but prolonged standing without proper support increases the amount of pronation and puts strain on the plantar fascia. Excess pronation. This is a fancy word for flattening of the arch, and it's normal motion that's part of walking. It involves the foot joints moving in multiple directions at the same time. It's what allows our feet to absorb those tremendous forces that we place across them when we walk. The problem is when we have too much pronation from having a tight calf muscle or unsupported pronation with prolonged standing without proper support of the foot, or overuse like we see with weekend warriors, those end up resulting in plantar fasciitis. Obesity is an increased risk factor due to the amount of force. And of course, improper support and improper shoe gear is also a risk factor. Plantar fasciitis and heel pain can be debilitating, and it can prevent you or your loved ones from doing the things that you want to do and enjoy. The good news is there are solutions out there that we can treat this, whether you're in that very acute stage or that chronic stage, and reduce the pain, get you back to the activities that you enjoy and love, and back to doing the things you enjoy and love without having to deal with the pain. We hope it's been information for you. If you have any questions, please don't hesitate to reach out to us, text, call, email, or come by and see us if you need an appointment.